So we know that we're now in the full and open board meeting, and our agenda is to record apologies and late items which we all know are well and truly covered off, and we know the registration of interest is there for us to enlighten as we see fit. We've got the minutes of the previous meeting on page 91. Karen?
Do you want conflicts of interest related to today's items declared?
Oh, yes, please. Sorry, yes, please.
Just mentioning there's an item in the Chief Executive report around MECA negotiations, and just it is recorded on the conflict register of interest, but that I'm an NZNO member and delegate.
Thanks, Karen. And I'll also just make the observation there that we're going to change the heading for that item. You make, yeah, and that's all sorted. So Jeff will articulate that when we get to it.
Thank you.
No problem. We've got the minutes of the previous meeting. That's the on pages 91 to 98. Are we prepared to move them as a true and correct record?
I'm happy to move, Brendan.
Thank you, Vaughan. So moved by Vaughan, seconded by Muriel. Are there any matters arising from those minutes? No matters.
Can I just ask, sorry, Brendan, just about the schedule of matters arising.
Yes,
the copy of the Māori Workforce Development Plan, is that being put onto the board site? Because it says it's completed. I may have missed that it was sent, or that it was because we asked about it. I'm not sure. Is it actually on the site? It's Keyur.
It sounds like it's not. We're just checking. What do you know, Nick?
Yeah.
I'll
So that's incorrect. It's not complete.
So just help me up to page
99.
We're on
99.
page 99.
Copy of Māori Workforce Development Plan.
Right. Okay. Can we? So we'll especially note that, and we'll get that checked.
I'm fairly confident that it was last time I looked. I think it was up quite a while back.
On the governance side?
Yes. But
okay.
I could be wrong, but I just, for me, it's ringing a bell that we checked that and it was made available.
Okay, thanks.
Right, we're going to check it again, and if it's not, it will be.
Thank you.
Thank you. Okay. So I can put the resolution that we're going to move in a second, and the minutes are true and correct record. I'll put that aye and against. It's carried. Thanks, guys. So we're moving straight through to page 101. The chief.
Brendan, can I just sorry, just interrupt rudely. Sorry, it's just occurring to me that given we've started this meeting early, there are people who would normally be participating in this meeting from the executive and others who wouldn't. And I'm not sure if we've switched over and got the right people in the room or on the Zoom.
Hold on. So on my paper, it's administrative matters are starting at 10:20, yeah. And we're on.
Oh, it is? Okay.
Yeah.
So is Keyur not on the line? No. Okay. It's all right. Don't worry. Don't worry. It's all right. Sorry.
Keyur, Daryl, Neil, not. Okay. Yeah.
Do you want to go and bang on the door or something? Are they due to come on?
Yeah, they are.
Oh, okay.
So we'll just get Jeff to go and bang on a few doors, and we'll get somebody out there to chase them down. Thanks, thanks, Jeff. They're probably having a nice cup of tea.
So, Brendan, do you think we should have a little 5-minute break just while they get themselves sorted? Or...
It seems to me that it sounds like a constructive suggestion. So don't go away, but we'll just take 5 minutes. The time now is exactly 10:25. So 10:30, we'll come back on, okay?
Yep.
Keyur, I'll just... Is this recording? Is this to be recorded?
We've just, we were just looking for you. We're just taking 5 minutes.
Yeah, we've just been sitting here, Kath, we've been shadow observers. You good?
Getting there.
You look totally relaxed.
Oh, do I? Yeah, well, it is quite relaxing sitting on a nice comfy couch in the sun.
There is.
Yeah.
Look, Kath. A new wardrobe of tracky decks and onesies to wear to work.
Yeah, I've got my tracky decks on. I'll just pull that over so you've got your t-shirt and tracky decks. Maybe that's not the done thing because it's a meeting. Maybe I should have gotten to real clothes. But I'm figuring because I'm officially on sick leave, I could have a bit of leeway with the wardrobe.
Yeah. Yeah, look, I'm sure some latitude is allowed.
Okay, we're just having a 5-minute break. We've just finished HDF. We started the board meeting, but our timing is right for our papers, but you guys might not have been advised. So Jeff's gone out looking. Thank you, Neil, and I really need to put my glasses on.
Thank you, John. Nice to see you. Nice to see everybody else as well. Although I can see Heather, I can.
So we have this large LCD screen, and we have a series of video, like cubby holes with faces in most of them, and it's a matrix of 5 by 4 with another level of 2 at the bottom. So the faces get quite small, especially for Neil.
Yeah, I know. And I can see Kat as well. Hello, Kat. After a long time.
Okay, how are you?
I'm good. How are you?
I'm good, thank you. Definitely getting there. The only disappointment, I wouldn't recommend this. I was hopeful this was going to be a significant, sort of health kick and that I might lose 10 kgs, but apparently not.
You've got a lovely painting behind you. Lovely colours over there. Yes.
Well, it's quite warm. Okay, while we wait, can you give me, once we've finished with all the meetings, can you give me a call, please, on my mobile?
Sure, I will.
Thank you.
After the entire meeting.
Yeah, perfect. Thank you.
Yeah, over there.
How was your earthquake experience?
Crikey, at my place it was really scary.
I reckon my house turned on its axis.
Dave from Swansea
trying to scare us all. Hey, Brendan.
So what was that, Lou?
It was just a horror whenua trying to scare us all.
Oh, just showing our muscle, mate.
It didn't work.
Dave from Swansea Clothing was interviewed on national radio, and he said his next job was to go around and pick up a whole lot of broken vases, but he said on top of a hill he had quite a novel experience, one he didn't wish to repeat. All right, I think
We're just waiting for, where's Jenny? Here she is. She made a nice cup of tea, so she's all happy now.
Yeah, yeah, listening.
Are we ready to go? Right, I think we're good to go. Trying to check. Here we are. Okay, right, so we'll reconvene, we're back in action, and we're on to the CEO's report, which is in the hands of Jeff this morning.
Thank you, Brendan. I'll obviously take it as read. I'd like to highlight three main themes though. The first is the work that has been continuing in major capital projects such as the mental health business case, ED pods. There's a lot of work there that has continued whilst we were also focused on the next thing I'll talk about. So Spire, things like low voltage actually brought forward and so that we were electrically safe. And a commissioning of the LINAC, which is work that has to continue. Of course, the second thing is whilst we were doing that, we were preparing inside the buildings for what we were seeing overseas. Thousands of COVID presentations with up to hundreds of deaths. And we had to be prepared for that. We had no idea whether or not Ashley and his team and the team of 5 million would crush the curve. So we were transforming the facilities, the digital infrastructure, and the way staff worked within a hospital. At the very same time, a huge amount of work in the primary sector and the community to do things we've never done before, swabbing and separating out respiratory illnesses. And then standing back, as already been pointed out in the HDAC thing, and letting people get on and do the right thing in the communities. And the awesome example of the iwi and Mara providers coming together as one and acting very fast. So all that has been an incredible amount of work in a very, very short time frame. And to pick out any individual person or part of the organisation would be wrong. It has been a magnificent team effort. And I think thanks is too small a word and praise too small a word for the people who have worked above and beyond under anxious and difficult circumstances for them, their family and their community. And all the time imagining the worst possible outcome and trying to avoid it. So I'll just highlight that. The other strand is what next? We are obviously planning the budget for the next financial year, the work for the next financial year, and as Judith and her team will lead us through the recovery and regeneration of our health system locally and in our district and also nationally. And that is a huge amount of work so that we bake in the good things, we stop doing the bad things and do that at pace. The other thing I'd like to apologise in the report is item 4.2, the heading should be industrial matters rather than industrial action. Industrial action does have connotations which were not intended in that, and you'll change that. I leave it there. Apart from the examples, the incident management plans are there really as illustrative examples of the IMT, incident management team, the emergency operating centre, and the plans that were developed at all levels to try and at least capture some of what we were doing, but really scratching the surface. So I'll finish there and happy to take questions.
Okay, thank you, Jeff, for the summary, and we're open to questions from board members. Vaughan?
I'm okay.
Just kill your mute, Vaughan.
Yeah. That's it.
Kath's got a hand up.
Where's Kath? Oh, there she is. Sorry. So, Kath, sorry, yeah, got there.
Oh, that's okay. I was just wondering, Jeff, you might. Oh gosh, if people could go on mute, we're getting a bit of feedback, I think.
Everybody's on mute, but we've got terrible feedback.
Oh, maybe it's me. Okay, I'll go on mute in a second. But I was wondering, Jeff, it might be helpful also just to update the board on the positions that are vacant and where we're at with Calvin and the other two, and the other clinical executive role, which is not in the report, but it might be helpful for people just to know.
Okay, I'm muted now. No, we're right. Sorry. Okay, the Chief Medical Officer, who is going to be coming over from Australia, is due to land in the country on the 4th of July. At this stage, we'll have to quarantine for 2 weeks in Auckland before coming down to Palmerston North. So hopefully mid-July. We have failed to recruit to the clinical executive of acute and elective services, but we have 2 clinical leads acting clinical leads in medicine and in surgery who are providing joint leadership and assisting Lynn in that cluster. From the chief executive position, perhaps Kath, you might like to update.
Do you mean me? Oh, I can't hear anything.
Sorry, you just were asking for an update on executive positions. I've updated on CMO and on the clinical executive for acute and elective services. But in terms of the CEO, were you wanting me to update on that as well, or would that leave that to you?
Do you mean, but I'm not sure what you're talking about. Are you talking about me?
You, yes.
Oh, about me. Right, yes, well, fine. Might do that in part 2, eh?
That's fine.
Kath, it's always about you. You should know that.
Oh, and please, some things haven't changed while I've been away then.
Okay, so are there any questions from anybody else in relation to Jeff's report? Can I just make some observations? This is you know the board meeting after the depths of COVID. Our last board meeting, you know, we were in it. This is now as we're exiting out of it. At our last board meeting, we obviously acknowledged the work that was going on. I think now as a board, we've learned so much more about the effort that was delivered by this board. Very, very difficult to acknowledge. And as Jeff said, you know, it doesn't matter what word you use, they're pretty small. But we do need to place on record from the governors to you, Kath, and all of your team across the region. I'm not focusing on just the hospital, across the region, that an extraordinary effort has been delivered. An extraordinary effort. And every one of us can tell a story that we've heard from somebody about how good it's been. Now, one staff member that I spoke to made the comment that the last 7 weeks were the most exciting for such a heck of a long time. And I thought it was quite extraordinary that, you know, we have this perception that everybody's up to their ears in it, but actually this staff member was really pumped and motivated by the adventure of the last 7 or 8 weeks. And I think that reflects that the energy that went into this really did make a difference. So I just want to place that on record so that it's not lost. You'll see at the top of page 103, a particular imperative is accelerating our digital strategy locally while not being held back by regional issues. That one paragraph, that simple 2 lines is crucial. crucial to what we want as a board to see activated. And I know that as a team of management, you too clearly want to see some traction. If we go down to the, if we go down to the bottom of page 104, where we go to item 5.1, appreciation to staff, I do particularly want to just highlight the We Are Ready videos. Now, I don't know whether you've all had the chance to see them, and I'll be honest, it was only by good management, good luck rather than good management, that I was able to, because I'm not as technically advanced as some of you, but that is a stunning storytelling opportunity. That's, you know, I don't know who drove this, Keyur. I presume you are one of the key people in that space, but sorry, there'll be John. Okay, there'll be all others that I don't know about, obviously. But can I just say to whoever it is that drove that, fantastic. Not only was it we got staff members profiling themselves, I suggest they're also getting some experience being in front of a camera. There's a couple of people look like they're in the, you know, like in the gun sights. You know, the eyeballs are sticky. But great effort and great energy, and I just wanted to acknowledge that because I think it's fantastic. I've written a whole lot of smiley faces on my screen here on page 104, and Jeff's obviously looking over my shoulder and can see it. But I just think that we've got such energy in here at the moment. We clearly don't want to lose that, and we want to take full advantage of it. And as we move into our workshop this afternoon, we'll start to see how we do that. So I just need to make those observations to you, Jeff, as the author of this report, to you, Kath, as the CEO, and to the whole team. There's a general nodding of heads of youthful enthusiasm, so I think we can pretty much say that we can receive the CEO's report, and we've got the resolution right at the top there, which is simply to update the key local, regional and national matters. So I'll move that accordingly, and it's seconded by Oriana. In favour, please say aye, or please raise your hands. Against, it's carried. Thanks, everybody. So the financial update. So this is the financial update for April. We know that the March information is there previous, and as we've done historically in these situations, we'll focus on April, and when we move our resolutions, we'll adopt the March ones as well because of the rollover, unless there's any specific questions or points of clarity that we need to go to. So if we can move through to the financial report, that's page 128. Where am I, Brendan? I should be able to do this quicker than he should not. Yeah, and we've got, Daryl's here. Daryl and Neil are here. Well done. Thanks, guys. So we're in your hands.
Thanks, Brendan. So just to note this shortened report this month, just purely because of timing. In terms of the result, obviously not a great result for the month, but clearly obvious that a lot of that has to do with COVID-19. The report itself tried to separate those out so that we can see both the COVID impact and the impact if COVID wasn't there. And so when you look at it without COVID, obviously you know, we're pretty close to our budget. I'd say on budget actually for the month. So it was a good result in that sense. Two things that are outstanding. Obviously, the revenue was greater than we expected, but that went right through out the door in terms of payments to providers. When you have a look at what is left, it's really just the two, I guess, things that have impacted right across the year, and that is acute and elective and mental health in terms of the staffing. There were some favourable results in clinical supplies and infrastructure, and you could argue that actually because of low activity in the hospital that, you know, that's a result of that. The other side of that obviously is COVID, which makes up the adverse variance for the month in its entirety, really. And we've tried to separate those costs out. Half of that, 1.5 of the 3 million adverse, is related to revenue. The rest are cost related, and we've tried to separate those costs in what we call direct costs, which we're reporting to the ministry on a weekly basis. And also what we've called non-direct costs. So those are costs that are clearly related to COVID, but we're not reporting them, and there's certainly no sense that we'll get reimbursed for those. And that's largely annual leave for the month was actually quite an influence. So people not going on annual leave, and therefore, as a consequence of that, our costs, ordinary time costs, went up. In terms of the forecast going forward, we're really actually quite confident now that, again, if you put COVID-19 to one side, that we would achieve our $12.1 million deficit. So we would be on budget for the year. COVID-19 itself, April was the largest, obviously, it was quite significant. We still think we've got some significant costs coming through into May and June, but not as high as April. So we've still got a little way to go as these costs continue to come through. And also because of sort of reduced capacity in the hospital, even though we're doing electives, we're not doing them to the degree that we were prior to COVID. So that's it in a nutshell. Happy to take any questions.
Karen? And then Jenny.
Thanks, Daryl. Hey, my questions really are related to the COVID costs and the year-end forecast of there being 7 million impact onto our deficit. Looking at, and obviously that's broken down with the 4 million to date and then an estimated 3 million going forward. I note that about $500,000 of that 4 million to date relates to annual leave that's not been taken. In terms of the estimate of that 3 million going forward, is any of that amount to do with an estimate around annual leave not being taken, or what's the assumption going forward, I guess is what the question is.
Yeah, no, so we haven't, April in particular, it was quite noticeable that people weren't taking annual leave for good reason. There was actually nowhere for them to go. There will be some of that, we think, in May, but as we've gone down to level 2, so the expectation is that there won't be a lot of that going into, certainly not into June, maybe, and not the second half of May.
Okay.
Probably worth noting also, some of that 7 million, we expect that some of that will be reimbursed by the ministry. What we're not doing is booking revenue until we actually know what that looks like. So basically, when we know the numbers, we can quantify them, we can book them with certainty, we'll take them to the bottom line. In the meantime, what we're doing is keeping it clear for you by separating out those COVID costs from what the bottom line would look like otherwise, just so we can track it through. And there'll be some stuff that we never get to recover.
Yeah, thank you. Just a further question, if that's right, Brendan, just related to the funding, the COVID funding that we have received to date on page 134 and that chart. So am I understanding correctly that 2.1 million distributed, of that 3.8 that we've received, the difference being 1.7, are we assuming that 1.7 million is money that the DHB will get to keep, or is that allocated to something else?
We would definitely not assume that we would get to keep that money. So if I take, for example, a lot of the money is basically what you call pass-through. So the ministry is sending money out to primary care, but it goes straight through our accounts. But let's take CBAC establishment as an example. We have received 1.163 million, and that's sitting in our balance sheet. We have got costs so far as of the end of April of about 300,000. Whether we continue to spend all that money before June, making the assumption that we will get to keep whatever's left if we don't spend it all is not an assumption that we would make, and we're not clear on that. So there might be some kind of wash up after the fact. The ministry is, as I say, we're reporting on a weekly basis, so they're keeping a pretty clear eye on what money we are spending in terms of all the COVID costs.
Yeah. Okay. Thank you. And to date, obviously, are you saying that we haven't been given any indication of how much will be funded for the COVID-related costs going forward?
No, they. I think at last meeting I said that again we're reporting on a weekly basis. What I have noticed over the last 2 or 3 weeks is they're starting to ask a lot of questions in more detail around what those costs are. So they're clearly sort of forming a view on, or at least trying to understand the nature of the costs. And some of the indications are that, from the questions that they're asking is that they are not going to fund costs that we would expect them, we see as COVID costs. So I'll give you an example. There was a requirement that we pay casual staff that we didn't have work for. We paid them anyway on the basis of what they had paid, what we had paid them previously. So even though we could not necessarily at work, we had a requirement to pay them at their standard hours for. They're also saying that they don't see that as a COVID cost. So we've incurred costs for a workforce that we're not necessarily using based on instruction, but they don't see that as a COVID cost.
It's ridiculous.
So are we using that workforce as a priority?
The directions from SSC on payment of casual staff continued right up to the beginning of level 2, and even now for Horowhenua, where we're not able to offer employment to a particular casual staff member, we still have to continue paying them based on their average earnings over the previous 4 weeks before we went into lockdown. So the intention is to try and get them back as soon as possible, but where the DHB is unable to offer them a safe return to work, especially with right up to level 3 and now at least one person into level 2, we are required to continue to pay them as per SSC requirements.
Okay. My question was around if we're required to pay them, are we utilising the workforce that they could provide at the same time as a priority? Because obviously there are additional staff.
The answer is when we could, yes, but a significant number or proportion of our workforce were unable to work because of their own health issues under level 4 or level 3.
And are you saying that they're not counting that as a COVID-related cost?
Correct.
That's correct.
It's very odd.
I think what you'll find, Karen and board members, that the best word to describe the negotiations between the ministry and DHBs in relation to direct COVID costs is the word fluid. So there is absolutely no utter clarity. In other words, there's no clear description of what we will definitely be funded for and what we won't be funded for. A great example may well be, for example, the iPads. We acquired quite a number of iPads under urgency. We had a whole lot of staff going home. We needed to make sure they were technologically connected. Their argument will be, well, you're going to continue to use them now. Why should we fund them? So I don't envy the team, Daryl and Neil, at all in the negotiation. 20 DHBs will be at the ministry at every level for the best part of, well in excess, I'd suggest, well in excess of, I don't know, $100 million of COVID expenditure across the nation that will be hits on DHBs. So it's a real challenge, and no doubt the finance teams across the 20 DHBs will be collectively setting their positions for the hard-nosed negotiations that are going to have to occur. Otherwise, it's a hit on us. Okay.
Thank you. Thank you. I just had one further question, if that's all right, Brendan.
Final one, Karen, yeah, then we'll go to Jenny. Yep.
Just that 3.1 million estimate that is for the remaining 2 months of the financial year. Is there any breakdown of, I couldn't see a breakdown of that anywhere, but do we assume that that's personnel predominantly, or what's kind of making up that extra additional 3 million?
I think if you look at the costs that and the loss of revenue that we've incurred to date, it's effectively that extrapolated out, taking into account the changing nature of the pandemic.
Okay.
Thank you. Jenny? Oh, Jenny?
Thank you. My question I'll come to in a moment, because I just want to take the opportunity again to pick up on what you've just said, Brendan, and the your words, hard-nosed negotiations that some of the operational team needs to do. I have asked throughout this what you can do as board chair, given you have the direct line of communication with the ministry, and I'll ask that again, because surely as governance, and we're all shocked by that statement of not knowing what compensation or reimbursement we'll be getting, how can we support that through you as the chair, Brendan?
So every chair is on the phone every Friday morning at 9:30 with the minister and the ministry. And every meeting we are given the same message from the minister around what our objectives are. And it's patently clear, the message is that we must target a balanced budget for this coming year. So that's the first thing. The second thing, in relation to COVID expenditure, which was specifically your question, we are told very clearly that there will be some areas of expenditure that will be covered, and there will be other areas of expenditure that will be, I'll use the word negotiated, and I use the iPads as the example. So we're arguing we had to acquire them. The ministry will be saying, and they are, well, hold on, you're going to get ongoing value from them. Maybe they'll pay a portion towards it, I don't know. But I can assure you that the chairs are very aware collectively of the impact and are very strongly articulating our position on that.
Thank you. So that last part is what I was looking for, because the first part was about what they're telling you. So the last part, you are articulating back the impact on our board, on our staff, and on our community. Okay, thank you. My question then in regards to finances is in regards to the leave liability. And first, I do want to acknowledge that annual leave is, of course, for the purpose of rest and relaxation for our staff wellbeing. So I definitely want to acknowledge that. Annual leave, and particularly those high balances in over 2 years that we see, we've seen in the earlier part of the meeting too, is a reoccurring theme. Now to focus on the financial impact on that, and you've touched on what the cost of this is during the COVID time, but overall, does the board have a clear understanding of our total leave liability as an organisation? So each time we get this performance indicator report, we see that there's these high balances and that we're, for a range of reasons, not able to move on them a lot. What is our actual collective understanding on our total leave liability as an organisation?
So we'll ask Keyur to comment.
I don't have the figures in front of me right now, but what I do know was before COVID hit, over the last 2 years, we've been working on reducing our leave liability, which consists of two bits, the accrued and the entitled bit. And we had reduced from one of the DHBs with the maximum leave liability to somewhere less than half. So our liability had gone down from memory, 13% down to under 9.3%, which has since increased once again following COVID. It picks up pretty rapidly because of a number of reasons. One of them, obviously, staff not taking the leave. And over the Christmas period, we do expect a lot of non-clinical staff to take leave and stuff like that, but clinical staff tend to take more leave around March, which did not happen this time. And also the leave entitlements of various professional groups is quite generous. There are some professional groups who have just a simple annual leave entitlement of 6 weeks. And then in addition to that, there are other leave types which make up the total leave liability for that particular professional group in excess of about between 9 and 11 weeks, which is a significant amount. And these things just add up quite rapidly. That said, we do have plans in place. Unfortunately, the last 4 months have pretty much been written off. But we are focusing back on them now as we are winding down from the COVID situation to encourage them. But most of the responses we have got so far is, where am I going to go on leave? All CMEs cancelled, all travel, national as well as international, is cancelled. So, I mean, just the domestic travel is just about starting now. And it's also people are unsure of their bookings because they have been stung, for want of a better word, in the past, especially with the rapid changes to insurance policies that happened over January and very, very early February. So I do want to assure you that we are not off the scale in terms of our annual leave liability, but it is certainly something which is on top of mind, and we are continuing to monitor it now.
Thank you. And Daryl, in terms of the dollar cost of this, is leave liability captured under the personnel line or under non-current liability, or where do we actually, I'm also interested in that dollar.
Yeah, so obviously when people earn their salary, we're also accruing a portion of annual leave, and that goes to the balance sheet, which is the liability you're referring to. So it just keeps adding to increasing as people earn annual leave. And when they take it, it comes off that liability.
Just to add, as collectives get settled and the salaries continue to increase, so will the leave liability of the total cost as such.
I also just reassure the board that operations executives and clinical executives have getting the message out there to try and get staff to take leave. Staff are tired. They've come through a really tough 8 weeks, and try and encourage leave to be taken where possible, remembering that we're also ramping up recovery, and at the moment somewhere between 85 and 90% of surgical throughput right now. So we're trying to achieve that and also get people away on leave. So it's a delicate balance to play, but very much aware of it and its effects on the bottom line.
Okay, John?
It's really a question for consideration for Oriana, Daryl, Neil, and our chair and our chief executive and our acting chief executives, whether we actually look at a balanced budget rather than a deficit, given that we could be getting into quite austere times if we find ourselves using our red resources more than planned.
Can I suggest there might be a conversation we take in the next part of the meeting to talk about budget updates where we're at?
Perfect, thanks Neil. Okay, board members, is there anybody else wish to make any comment or observations in relation to the March, March-April figures? I think we're understanding what we're doing. Right, so I'm going to go to the resolutions for April, and you'll see the notes and observes all set out there. Rather than me reading them all out, prepared to move. Is somebody prepared to move the resolutions in block? So it's moved by Muriel. Is there a seconder? Seconded by Lou. Is there any other discussion? So I move in block. I'll put that in favour, raise our hands. Against, carried. Moving to the March, can we just move receipt and recommendations, given that we've done April? Just it's a formality, but so it's moved by Karen, seconded by Heather. Thank you. I'll put that in block in favour, raise our hands in favour and against. So those resolutions are carried. Thanks everybody. So that's just a technicality, but it tidies it up. So we're moving to page 162, which is the performance improvement plan. There we go, thank you. It's great having two technical people, one each side, because I can just show you where to put the cursor.
In musical terms, it could be syncopated.
Okay, so who's leading this? Is Judith? Oh, there she is. Thank you, Judith. I just couldn't find you. Thank you.
So normally this paper is presented by Doug Barnes, but he was deployed during this period into the incident management team. So Leah did produce the report, but I've taken it upon myself to present it to you today. You'll see Doug later for our workshop. I just wanted to highlight a few issues or a few areas within the report. Normally this goes through FRAC first, but because FRAC hasn't taken place over this period in advance of this board, you're receiving this with the April data without it necessarily having first been presented through FRAC. I would like to acknowledge that the data, although there's no data in this particular report relating to ethnicity, we have made some progress in the last 3 weeks, and there is now some ethnicity data which will appear in your next performance improvement report and will be moving forward. So I'm pleased to report we have made some progress regarding that. Some of these issues have been highlighted in the previous HDAC, so I won't repeat those. But it's fair to say that the planned care progress in terms of meeting SB5 and SB2 have been severely impacted as a result of COVID. Particularly SB5, and Jeff has mentioned the backlog of surgical work that is now in progress of being dealt with as fast as is feasibly possible. And it's likely that both SB2 and SB5 will remain challenging until we progress out of the COVID experience, but I know the teams are working extremely hard. The SB2 performance is slightly better, and I would like to point out to the board that over the COVID time, 70% of our attendances at outpatient were delivered in a virtual means, which was quite extraordinary and significantly higher than we've seen at any other period over our history, I think. And it's one of the areas that our clinicians are increasingly interested in maintaining into the future, and we'll be discussing that this afternoon. So as a result, a number of outpatient appointments were delivered and can still be counted towards the SB2 target, and also towards our challenges in terms of overdue follow-up, which is pleasing. The other area I wanted to highlight was the improvement in our data remediation regarding the follow-up data. The board will be aware that we uncovered a problem there relating to the introduction and transfer of data relating to WebPAS from 2 years ago, and we've now almost cleared that backlog. And I would like to reassure the board that in addition to almost clearing the backlog of remediated data, we have had no specific additional incidents, quality incidents or safety incidents. So the vast majority of those patients were, as we thought, patients who didn't require follow-up and actually should have been discharged. But I would like to commend the team who've done a huge amount of work in the last few months remediating that data. Of course, we now move on to ensuring that patients who do require follow-up are actually seen on time, which is our next focus. Moving on to acute flow, Lynn has already commented in the previous HDAC meeting about acute flow. So while we did see a reduction in ED attendances, our acute flow SSED target has only risen slightly since the COVID experience, and that was relating to the changes that the ED had to put in place relating to COVID, and also the significant changes in the way that our hospital had to operate over the COVID period, which meant that we had to design green and red flow channels, and that impacted our ability to admit patients as quickly as we might have liked into the specific areas to ensure safety. However, I do want to point out that the acute flow target, that SSED target, has increased month on month for the last 6 months. So it is important we are making progress from our baseline in the winter of last year. The other area I wanted to draw people's people's notice to, is the savings plan. So we've already touched on the annual leave issues, so I won't go through them again. But overall, in terms of our in-budget savings, we are tracking largely to budget. However, the area of concern, of course, is our initiatives outside of budget, effectively our savings programme for future years. There are a number of initiatives there which have not delivered as we would have expected. Some, despite all work to undertake a savings programme, such as our compounding programme, they have not been possible to generate in-year savings, but we are looking at other opportunities to release some savings in pharmaceuticals, and they're noted within the paper. Some of the other areas of work have been impacted by COVID. Certainly the ability for us to engage directly with clinicians around continuous improvement in acute flow, and also some of these projects related to ongoing savings have been significantly impacted, and there just simply hasn't been the capacity to look at those areas in any detail over the last 6 to 8 weeks. So I'll leave it at that, and I'm happy to take any questions.
Thanks for that detailed summation of the report, Judith. And I don't think there'll be too much pushback in a number of the observations that you have made. I do want, though, just to make the acknowledgement for those of us that were on the board last time round, my never-ending mantra about fax machines, and it's wonderful to see that the decommissioning of dinosaurs is underway. And no doubt will be resolved shortly. So Barbara Robson, previous board member, took great delight in messaging me the other day, because she'd obviously observed or heard that the decommissioning was underway. So I say it in jest, but we have got on about it quite a lot. Are there any questions of Judith? Comments? Observations? So Judith, clearly the board understands what's happened over the last few months. I think the only observation that I would make is in terms of looking forward, not back. We don't want to be too ambitious when we're setting our targets. I'd rather, because you know what I mean, it's the emotional thing as well. Oh, damn, we didn't make it. People get a bit down. So I felt, it was a number of millions of dollars, $6 or $7 million of target. So I think as you are preparing, as we are collectively preparing for this year, we still need to focus on where we can get some efficiencies. But I think also just maybe a bit of a measure on how ambitious some of them might be. That would be my only observation. In other areas, of course, it's been brilliantly successful. Kath, can you mute? Seems to make a heck of a difference when you've got that on mute, Kath.
Sorry, I just had to, my little earset thing went flat, so I was just getting onto the iPhone. Sorry.
Okay, all cool. Judith?
Yes, thank you, Brendan. I do think, yes, we don't want to make our targets too ambitious, but equally I think our COVID experience has shown us that there are things that can be done.
Yes.
And I think I would like to suggest that the next iteration for next year of whatever we call this report, innovation, improvement, a savings programme, whatever it might materialise, that we take account of our different achievements over COVID and the way in which we achieved them. And I'm looking forward to that conversation this afternoon.
Yeah, brilliant. Okay, so can we move then to the recommendations, which is to note the progress, note where we were with the targets, and endorse the performance improvement report. So we're prepared to move. Lou, seconded Norman. All those in favour raise our hands. Against, carried. Thanks everybody. So we've got the quarterly health safety systems report on page 174. This flash is no idea. Keyur, are you good to go?
Thank you, Brendan. Yes, I am. And it is lovely to see you. Otherwise, the sun's shining over there. I don't know where you are. Definitely not on Main Street.
Sun's shining a little bit on that one, right?
Oh, it is too, yes. She's lost in the shadows.
Just quite a succinct report. And as I was putting this report together, this was obviously aimed at FRAC in April. But as that didn't happen, it came up now. It's a quarterly report from the 1st of January up to the 31st of March. The key things are that whilst the health and safety committees, the number of health and safety committees and the percentage of workplace inspections has dropped slightly. It hasn't dropped off significantly. The other concern that we had at the previous report was about the contractors' meetings being held on schedule. Now that's been back on schedule and a lot more, because we obviously work with contractors during this COVID period as well on a more regular basis to keep them updated and to share information with our contractors and tenants on campus. What I have done though in the quarterly health and safety dashboard is included 2 additional measures which were shown as graphs, the incidence of staff shortages and the number of workplace claims. Item 4 and item 7 have been added. Which were provided as separate graphs in the previous version of the report. No notifiable incidents. I haven't given too much detail in terms of the well-being and welfare activities because they were covered off separately in the report for the board previously, which is why I have not elaborated on that anymore. But this is just an indication of a more succinct health and safety report. So I'm ready to take any questions and any suggestions.
Thank you, Keyur. So are there any questions from board members? You'll note in there's a couple of the local health and safety committee reports as well.
Yeah.
Which were quite detailed, I have to say.
Yeah, that was something that was that the previous board required me to add, which is why I've added those as an appendix.
Yeah. So everybody's pretty comfortable. We've got a good understanding. Health and safety is crucial for us as governors to ensure that we are comfortable. One, that's being accurately recorded, clearly reported, and to be sure that good action is being taken wherever issues are arising. And certainly reading through the minutes of the committee meetings, that's quite a comfort to get a sense around the commentary that's being made and how things are being responded to. Right, there are no questions, so we can move back to the report, which is to note and endorse. Is somebody prepared to move accordingly? So that's moved by Muriel, seconded by Jenny. I'll put that in favour. Please say aye. Raise our hands as we do, and against. There's nobody, so we can carry that item. Thanks, everybody.
Sorry, Brendan. Just one thing, very, very quickly. We have the staff survey starting tomorrow.
Oh, rightio. Fantastic. Okay, thank you. So we're now moving to page 190. This is the page 190, which is the Enable annual report. Now, this is just a technicality, but Neil, can you just make any comment in that space?
No, you're quite right, Brendan. It's just a technicality. It's we do this each year. It's just to enable us to abbreviate the reporting for those things that are covered in the DHB zone report.
Okay, I'm just checking those. Are any questions from board members? We understand it's just a technicality. Okay, with that understanding, we've got the recommendation in pursuit of appropriate acts. Somebody prepared to move. Heather is moving, seconded by Vaughan. I'll put the recommendation in favour. Raise our hands. Against, that is carried. Thanks, everybody. So we're moving now to page 192, which is the annual plan and statement of performance expectation. Where's Craig? There he is. Welcome, Craig.
Kia ora, koutou. A lot's happened in the last week, actually, and this report is basically redundant, including the recommendations. So I thought I'd just update you on things that have changed, and then we can just talk about the new timelines and how we're going to work through it. On the 20th of May, so last Wednesday, the Ministry provided us with feedback on our draft annual plan and also provided us with updated planning guidance. Out of the 56 or so items in the annual plan, we got 23 of them we got the big tick for. There was about 30 odds that needed, 33 that needed some amendment, and then there were, was substantially approved, and we got no reds, so we got no rejects, so that's really good. The Ministry's provided more guidance around things like COVID and around some of the stuff that are themes which we all know about financial responsibility, and also some guidance. One of the ones that I think is quite important is around what service change means. And the board members will remember that if we're going to propose major service change, we have to actually include it in our annual plan. And this time they've clarified that anything that involves a substantial change in staffing and FTEs is now to be considered a service change. So we'll have to work out what that means and pull that through. The guidance also included new revised timelines. And so now we know that we have to provide the next draft of the annual plan and budget by the 22nd of June. Now, we don't have a board meeting planned between now and then, but we do have a FRAC meeting. And so the proposal is that we will look to have a board workshop after the FRAC meeting, and we talk about it, about the annual plan. But essentially what we'll do this time, I think, is we will submit the annual plan and budget on the 22nd of June, but it won't have been formally approved by the board. And the board will consider that at its next meeting. And then on 22nd of June, so that was last Friday, the funding envelope came in from the Ministry, and we're still working on that, and I think we'll talk about that later in the meeting. So that's changed. And then just this morning, more or less while we were meeting, the Ministry has clarified that the Minister has approved a change in timelines for the statements of performance expectations, and we now don't need to have that until the 15th of August. So that means the recommendations on the report you've got here, which were about clearing our way to publish those, the SPEs, we don't need to do that because we will be able to process that through a normal board meeting. So in short, the key things to note, the next version of the annual plan is due on the 22nd of June, and they're proposed to have a workshop if that suits everybody after the 16th of June FRAC meeting, and that the statements of SPE don't need to be up until the 15th of August, and so we don't need to deal with that today because we can approve that at a later stage.
So can I just reinforce this, because clearly as a new, I still consider us a new board. This is all for us a new learning as we go through the budgeting process, and I'm not at all surprised if a couple of people's eyebrows raised somewhat as you made the observation that we'll still submit the budget even though it hasn't been caught by the board. This is really, really challenging, guys, and so on the 16th of June, and Kat, we haven't chatted with you about this, but we have got the FRAC meeting for that day, and we've got to get together as a group. We've got to sit around the table, and we've got to have a good, meaningful session just to make sure that we are as up to speed as possible with this process that's ever moving. So as you rightly pointed out, Craig, in the last hour, another email has come through. Jeff's just trying to get a quick look at it now. I doubt that Kath's seen it yet. It's changing and it's evolving. So if we can please set aside that afternoon of the 16th of June to be available, I think that's our chance to finally pull all the detail together. We'll have a lot more clarity. The letter that arrived on Friday, that's probably going to take, goodness, I don't know, probably take a week or more to digest that and evaluate it and understand how that's going to impact as we prepare for a budget that the Minister has an expectation that will be a balanced budget. So that's kind of like where we're sitting at the moment. For us to input at this stage is incredibly difficult. So we need the machine to continue to do its work. Remembering though that we have board members really clear expectations around how we want to see service delivery occurring in our region. So those are some of the challenges that we've got. Is that fair, Craig, what I've articulated? Is that okay? Does anybody else wish to make a comment? So yeah, Kath, do you want to just add to that and then we'll go to Karen? Where's Kath gone?
Sorry, just technology issues. Just thinking, I doubt if the 16th of June is going to be, I'd be very surprised if we get to a point where that is the conclusion of what we need to be doing. It's going to go quite some time. But my suggestion would be, and I think it's a great suggestion to have the board, but I wonder if we might just make it a joint FRAC board meeting with a specific focus once we get through the things we need to in the FRAC meeting on budget, which could be by way of a workshop, but I just want to make sure we've got a properly minuted set of resolutions and conversations as well.
Look, Kath, I think this whole thing is very fluid, and if at that on the 16th of June a board meeting with resolutions is feasible and achievable, fantastic. My interest, my concern is I don't want board members to feel that we haven't had the opportunity to have that, you know, that good sound discussion prior to getting to resolutions. If we as a board are comfortable, I'm comfortable, but I don't want to be seen to be right. It's the last thing that I want. So if we need to have a chat and a yak to get our heads around it, that's where my focus was. But as this evolves, if we feel comfortable, I'm comfortable.
Yeah, I very much doubt that we'll be at that stage, unless there's a miracle that occurs between now and the 16th of June. Very much doubt that we'll be having a conversation about the break-even budget to the government.
Yeah, okay, so I think we're all, there's a general nodding of heads around the screen as well. So there's sorry Matara, you're in the shadows, couldn't see you waving, apologise.
It's all right, that's me, fringe dweller in the shadows. I just wanted to clarify, like the, on the 16th, so was the suggestion that it was a workshop around the annual plan and the budget? I just couldn't.
Yes.
It is? And that it perhaps be combined as a FRAC and board meeting to undertake that process. And then obviously that, yes, as Kath says, it would take a miracle for it to be completed there, which is probably unlikely to occur. But was it just more about continuing on with the process, the 16th input to the process?
Yes.
Yes. Okay. Yes. Well, I would quite like that because I am quite interested about also the opportunity for different measurement around our performance.
Yeah. Okay. Thank you. Thanks, Matara. Karen?
Yeah, thanks. The comment I was going to make has probably been fairly well covered with Kath's suggestion to perhaps make that FRAC meeting a board meeting as well. What I was going to say is my preference would be to have an extraordinary board meeting rather than just not having the board opportunity to approve an annual budget, you know, because of the where the board meetings happen to fall in the calendar. I guess the other question I had was just based on the update that Craig's given us, which of the recommendations in front of us are relevant to progress and which are perhaps not so relevant to progressive. I haven't got it 100% clear which things are due in June and which things are due on the 15th of August, but I wonder if that we might need to relook and perhaps make some adjustments to those recommendations.
Kia ora, Chair. if I just comment on that, I actually think that the recommendations we've got there are not, we don't actually need to do them at all at the moment. I could give you 2 recommendations, but they're both noting recommendations, and I'm not sure that that actually makes much difference, does it? We don't need any action or any authority at this stage.
Thanks, Craig.
Sorry, Heather.
Craig, so this relates to a comment on page 194 and with respect to the statement of performance expectation. I know technically we've approved it, but I'd quite like to revisit aspects of that because I've been going through it in somewhat more detail with a disability lens, and I'm really interested to look at the rehabilitation and support stuff and just some of the wording. And so is there will there be an opportunity to do that before August?
We'll be having a good look through that. So if you've got feedback or comments, then we'd be happy to receive them.
Okay, so if it's really focused on A4, it's the pages about at the output classes. Okay, I might just send you that rather than waste time talking about it.
Yep, that'd be great. Thank you. Okay,
cheers. Thank you.
Brendan, can I just make a suggestion? We pass a resolution. The recommendations are withdrawn, noting updated ministry advice which has been received as of today, and then I think we need to put in a resolution around all of those accountability documents being considered and the timeline being considered at the joint FRAC and board, so we've got it formalised and minuted.
Yeah, thanks, Kath. That's absolutely brought it together. There's a very, very sound nodding of heads as you've articulated that. So we'll just give Nikki time to make sure she's got some of that noted, or as much of that noted as practical, knowing this is recorded, so she can go back and get a bit more clarity. So in summary, we're going to tweak the resolutions for today's discussion with the objective that we as a board on the 16th have the opportunity to capture, one, to engage, and 2, to capture the essence and make the decisions that are relevant to us as we're going through this budget process. So I know I go on about it, but it's really, really important that every board member is comfortable with where we're heading and understands where we're heading as well, and then takes ownership of the decisions that we make. And I just do not want to rush that. So again, thank you for the nodding of heads. So, sorry, Norman, did you want to say something? No, okay. Right, now, are you comfortable with that you've got it noted?
Yes, so note that
Can you just read it out loud?
Yeah. So noting that the updated ministry advice received the 26th of May and all accountability documents will be considered at the 16th of June joint FRAC and board meeting.
Right, okay, thank you. So essentially there is going to be a resolution for today.
Can the first resolution be, please, that we withdraw the recommendations as provided to this board meeting?
Yeah, these ones here. So we withdraw those recommendations. Yeah. We note the ministry advice received up to 26th of May because there's been a sequence of advices.
Yeah, yeah.
And then the 16th of June.
Okay, Karen?
I was just going to say we probably don't need to withdraw them if they haven't been moved or seconded, because they don't actually exist unless they've been moved or seconded. They're just simply on the agenda paper.
Yeah, technically you're correct, Karen. Technically you are correct, yes. So
just give some clarity though, Karen, you are technically correct, but if you're looking at minutes, I think it just helps to say that we didn't want the board to consider them.
Yeah, so long as it's noted in the minutes in terms of the statement, we're covered. So it'll be noted in the minutes that we've determined through our discussion that we will not be noting, authorising or approving any of the resolutions on this order paper. We have fresh resolutions which has been articulated, and that's the one we're going to stick with. So for purity, I'll just get Nikki to read it again, just for purity, and then we're ready to go. Okay?
So we're noting that the existing recommendations to be withdrawn. We're noting that the updated ministry advice received up to the 26th of May. And note all accountability documents will be considered at the 16th of June joint FRAC and board meeting.
Right, so the very first line is just a minute item, it's not a resolution.
Yeah.
Okay, noting that the resolutions will be, so that's just a minute item.
Yeah.
Okay. Right, so that's resolutions. Okay, Karen, you happy to move?
Happy to move, yep.
Thank you. And a seconder, Vaughan, you seconding? Rightio, thank you. So we've got a mover and a seconder, and is there discussion? No, there's none. Muriel, you're happy? Yep, okay. Rightio, so we'll put that in favour, please say aye. And against, it's carried. Well done. Thanks for the discussion, and Craig, all the best with for the team and the work that's ahead of you. I know it's significant. Right, moving to page 195. 195 is the draft Māori equity, health equity dashboard. Tracy.
Thank you, Brendan. I've asked Craig to actually start off as a co-author to this piece of work.
Kia ora again, everybody. So this is a first shot at developing a Māori health equity indicator set for MidCentral DHB. Tracy and I have done lots of work on this, and our teams have been working on this really hard over the next little while. We wanted to have a coherent picture about what's actually going on across our full row here, across all the things that we're responsible for. We have used a lot of existing indicators. Of course, one of the things in health we are really blessed with is lots of indicators and lots of measures, but often it gets really fragmented and stuff gets reported in different places. So that's why it's so important to bring it all together. We've created, there's 27 measures here which are organised broadly according to life stages. They line up with Ka'au Awatea, which is our Māori health strategy. And there is potential for us to be able to develop this as we go forward and make it better. We are looking to, so it's not just an indicator set, because what we're looking to do is have execs within the organisation who are sponsors for each individual measure, and then to have basically improvement plans for each of those, so that over time we can leverage improvement. We were suggesting that we report this to the board because strategically it's pretty critical. I mean, the messages coming out to us from the centre, equity is vitally important. So we were suggesting that we report this to the board quarterly, but that we would report the improvement activities basically twice a year for each of the measures. We have to get the balance right so we don't go over inundating people with reporting and measuring. But the intention here is that we can start to leverage some improvement across these areas.
Thank you. Anybody wish to make any commentary? John?
Thank you, Craig, and thank you, Tracy. I think one thing that might be added to this and will give us great value is those consultations that are captured electronically. For example, how the GP teams have worked during the lockdown, but also in terms of mental health. We've found that with the court hearings, that being held by video link has seen a great improvement in the quality of these in terms of the parties taking place. Over.
Thanks, John.
Hi, Brenda.
Mataroa.
It's great. Thank you very much, Craig and Tracy. It's great to start sort of seeing where the opportunity lies. I was wondering, I was sort of having a look through, all of the clusters data. So obviously trying to look at what data is already captured. So as you say, it's not creating burden. And there was a couple of things I wondered about, like mahi tahi. Could we, the number offered to whānau, the number taken up, could we set a target for like 60%? You know, like I'm just putting 60% on, you know, so that we see improvement. I noticed that one of the key things around, you know, kind of integration is around having discharge plans, active discharge plans. So number of Māori who have active discharge plans. I also saw about, you know, things like the capture of consumer stories. So I wondered setting a target for the number of Māori narratives that are captured over a period. You know, so I just had a few things that I thought, gosh, we've got quite a lot going on there, but I see that some of those measures, if they had some focus, could actually start to look across the system and what's happening as well. So just some ideas, having looked at all the data that's captured by the different clusters, there's quite a bit in there that could maybe just be pulled across, and also some of our local things.
Yeah, I think that's really good feedback, Matiru. What my experience is once we allocate these indicators to key executives as sponsors to get their hands dirty on the actual issue, you'll find that they'll come scrambling for that kind of information anyway. But let's go offline and have a look at how we might actually get that more explicit into the way that we've got it in the dashboard, so that we capture it and make sure that we don't lose it as people are reporting.
Perfect. Okay, that's good. So Heather, what's your opinion?
One of the questions, and this relates to Mataroa's earlier comment about capturing information from Enable New Zealand about assistive technologies and housing mods. Do we capture actually anywhere in our reporting whether or not people are disabled and what the nature of their disability is when they are receiving services? So, so there's a double whammy there, capturing ethnicity and but also disability, and whether it's a sensory, physical. Because I also note that we're quite specific in one of the clusters about physical disability, but not about other disability. And hearing impairment and visual impairment are significant impediments to accessing and learning disorders, or intellectual disability are impediments to accessing services too. So is there some way, I think specific to Māori, we need to understand that, but also generally? So the data from Enable New Zealand, do you know, I don't know if they capture ethnicity in the EMS reporting.
Yeah, I think that's probably it. I'm going to have to throw that back to the board, Heather, because in the workshopping to date and making sure we stay in line with the priorities of Kawatia, we've kind of birthed these indicators from there. So if you want to add to those, look, I'm happy if the board's happy.
Do you want me to answer some stuff about the disability, Heather? I can take that offline with you. It's an area that we don't do particularly well.
Oh, okay.
I have plans though. I have plans.
Okay, let's do that as a next constructive step, Gaz, if you can talk with Heather, and then obviously back through to Tracy, and we'll just see what comes out from there.
Absolutely.
Okay.
Absolutely. If a recommendation comes my way, I'm happy to pick it up.
Kia ora, Chair, through you to Heather, can I just say that it was brought up at Mana Whenua Order as well, in terms of the lack of visibility of Māori disability?
Sorry. Norman, did you want to say something?
I think he goes to the Justice.
Are you good, Norman? Yep, good. Okay, all right. So I'm just making it. So we're all covered off, we've all engaged, so we've all made our commentary. Tracy, you sorry, who kicked that off? No, Craig, you kicked that off. Tracy, do you have anything more you want to add?
No, that's all good.
You're all good. Okay. So we've got the resolutions there to approve the indicators, the quarterly schedule, and the individual indicators through to the executive sponsors. Where did Muriel go? Is Muriel here?
No, she's dropped off.
Are you there, Muriel?
No, she's dropped off.
Oh, okay, okay. Is someone prepared to move those resolutions? So moved, Oriana, seconded by Lou. Any other discussion? There's none. In favour? Against? It's carried. Thanks, everybody. Rightio, we're through to page 201. Which is the recovery, heading and growth. Now, just help me here, Judith. We're going into the formal workshop this afternoon, but this is just an item on the board papers as an introduction.
Yeah, this is a paper to introduce you to your workshop. Our normal process is we do a paper for workshops, but I wasn't intending for you to discuss it specifically. It's simply to prepare for the workshop.
Yeah. Okay. So we can consider this a technicality. It's a process, but we're not going to go into the discussion now. So we've obviously already had the chance to read it. It gives us a sense around what's in front of us, and we know that this afternoon we're going to go into the deep and meaningful discussion. Yeah. Okay. So with that understanding, Jenny, are you prepared to move? And Norman seconding. So the receipt of the report. Put that in favour, please say aye. Against, it's carried. Thanks, everybody. Okay, so we've now got the board work program, which is really, this is on page 211, which is just the update as to where we are at. Jeff, do you want to add to that or not?
This is administrative.
Yeah. Can I just say that I'm really keen to, as we prepare next year's work program, because clearly we're near the end of this one, to do quite a lot of refinement and rethinking around what that might look like. So I've done some work on that and had a chat with Kath, and we'll get that through as we prepare for our next financial year. So really, again, it's a technical update about where the work is at. Are there any questions? Can't imagine that there will be. So there are no questions. So we can note the work program. So Heather, are you happy to move that? Mataro, happy to second? Yep. Okay. In favour? Aye. Against? It's carried. Just a bit worried that we've lost Muriel completely. What's happened there? Okay, so we can move through now. What have we got? Glossary of acronyms we know about. Late items, there are no late items, and we know the date of our next meeting is the 7th of July.
For which station should that be?
For which we will be able to face each other, I'm sure, which will be marvellous. Yes. Sorry?
Then you've got the 16th of June, yes.
Yeah, so do we don't need a resolution for that, do we? No. Okay. So the next thing is a recommendation to go into public excluded. So we'll formally move that recommendation. Then we have to go out, turn off, and come back in again because it's two separate formalities. So John's moving that we go into public excluded as per the recommendation, seconded by Vaughan. So I'll put that against, it's carried.